That's right, and health officials referred to this as a triple threat. They released some new numbers today that were pretty eye-opening when it comes to the flu. They say last year there were about 265 cases of flu around this same time, and now we're already at nearly 1,200.
A large number of flu cases this early in the flu season typically means flu activity is going to be sustained and possibly more severe. With some
And Dr. Wilma Mouton says in addition to flu cases, the number of RSV cases has hit more than 1,000, which is roughly 2.5 times higher this year compared to the same time last year. And we're also still dealing with COVID, though cases are declining. So just the fact that we've got all three viruses at one time is putting a big strain on hospitals, on emergency rooms. We heard from several speakers today, including U.S. Health and Human Services Secretary Javier Becerra, who just arrived in San Diego from Orange County, where he points out they've already called a state of emergency due to the high number of RSV and flu cases there. He says we're going into the holiday season. People are going to be getting together indoors. That now is the time to really take those extra precautions. Wear a mask in crowded places, wash your hands often, and make sure you are up to date on your vaccines. He says this is about making sure hospital beds stay open.
It is frightening when your child cannot breathe. I say that as the father of 3 daughters. You will do anything you can to keep your child safe and warm. But please recognize that there are some kids who absolutely need to go to the hospital. And there are absolutely things that you can do to prevent your child from being one of those. Help us make sure there's a bed available for your child or for your grandmother during this winter season when we know the virus is hit the hardest.
And so we really urge people to get their flu shots, get their COVID shots. There is currently no RSV vaccine available. Heather and Carlo.
So Kelly, getting the vaccines and taking precautions was obviously the big message here. But was there anything else health officials have emphasized to keep kids and the general population healthy?
Yeah, and you know, it's something that we have talked about before. One of their other messages was talk to your child's doctor first. You don't necessarily need to rush them to the emergency room. I just checked with Rady Children's Hospital, and wait times are still 4 to 6 hours long. So the bottom line, if your child has some mild symptoms, low-grade fever, maybe a stuffy nose, it's possible you can just keep them at home, but certainly still a good idea to check with your child's doctor.
Yeah, trust your intuition. Kelly, thanks.